Hello, everyone. Welcome to the MedTech Ventures, the podcast where innovation meets investment in the world of medical technology. I'm your host, Craig Townsend, and I am delighted to be joined today by partner at Turning Mode and entrepreneur Jorge Zapata. Jorge, how's it going today?
It's going well, Craig. Good to be here.
Wonderful news. Thank you so much for taking the time to speak with me and speak to our audience. You've got a great story to tell, Jorge, a couple of interesting developments that you've been doing over the past couple of years. So really, really excited to have you on the podcast. I guess let's start with you, Jorge. Tell us a little bit about yourself and your background.
It's very simple, Craig. I've been interested in technology and healthcare my entire life. That led to a career, of course. Um, being in innovation for 30 plus years on different areas, from service delivery to leading teams. But got really into it about 10 years ago when I started Turning Mode. I can tell you more about the details, but I don't know how much you want me to go into the weeds from now.
No, come on, tell us about Turning Mode then. Turning Mode was no pun intended, the turning point where you decided to pursue this full time. So talk to us about Turning Mode.
Yeah, so I worked for the large corporations for about 20 years in healthcare, developing medical devices, introducing medical devices to market. And it um, was very good to be part of those large teams. It was very good to be part of introducing great technologies to the market. But it always fell short. It always felt that it was this incremental innovation that really didn't address very specific workflow voids for the physicians, for the caregivers. And after 20 plus years, I got about 12 ideas that I felt I needed to pursue at least once, just to have the experience to try to innovate on my own. So that was the genesis of Turning Mode. It was an experiment to create an innovation lab in which we will prioritize some of those 12 ideas one by one, try to understand the problem really good, really well, trying to understand our solution and how our solution fits that market and the real value added to those caregivers. So one by one, we've been tackling some of those ideas. The first idea we started working in 2016 and an innovative illumination system for operating rooms was introduced at CES in 2020. Then another device that we work on to improve intubation on complex patients for anesthesia placement was introduced at CES in 2025. And we're working on a couple of other ideas that I'll be happy to share with you a little bit on the details of what we're trying to do. But globally, the whole point is how we can give time back to the caregivers, for them not to focus on technology, but for them to focus on the patient. How technology can actually help those caregivers focus on their patients so we can get better clinical outcomes.
It's an amazing venture, and it's important to look at it from a solution space as a starter. You're not necessarily you've got interesting technology that goes into your products, but you're really looking at the challenge first and foremost, and you're looking
That's right.
at devices and ways that can help solve that challenge. So it's quite interesting that you see a lot of modern startups. You see a lot of investment right now that is going into strong, disruptive IP and technology and innovation. And one of the biggest challenges is, where do we find a practical application for this technology, for this IP? You've absolutely turned that around and said, no, let's find an application and then build technology which can help provide a solution within that space.
Given that I was lucky enough to be in the sector for 20 plus years and saw what was needed, so I got very lucky to have the opportunity to see the caregivers in their environment helping the patients, mostly all of them, with passion, trying to get those patients to get better, to get the outcomes, the clinical outcomes that they needed. But I saw the struggles, either they didn't have the technology necessary for them to get the patients to where they needed to be, or dealing with technology to get their patients to where they needed to be. So it was pretty clear, at least a dozen ideas in, how very simply we can help those clinical workflows to be a little bit better, give the surgeon 1 or 2 seconds at a time back to their patient, or give a nurse a few minutes for a better triage opportunity to their patients, or how we can get end-to-end visual to an anesthesiology for them to do a proper intubation. It's that simple.
Absolutely. So let's talk about one of these solutions then. You mentioned the two products that you launched at CES 2020 and 2025. What are you working on right now, Jorge? What can you tell us and tell our audience?
Yeah, sure. We see a big problem in nurses shortages. We see a big problem on patient mobility while at hospitals, right? So we got intrigued on how patients while at the hospital get triage and monitored. And we realized that a small portion of those patients actually get actively monitored. About 10% of the patients are actively monitored, most likely in the ICU, on a recovery room. The nurses to patient ratio are too high, 1 to 1 is not the case. Maybe 1 to 3 in a ICU, but really 1 to 8, 1 to 12 on any other place in the hospital. So we realized that a patient is pretty much alone, not monitored, while at the hospital. And while that's probably okay for most patients, the nurses, the caregivers will need some information about those patients while they are not with them. So how can we give data to those caregivers about their patients while the patient is alone at the room, while at the same time we don't impede patient mobility, meaning we don't tether the patient to a device, right? Or don't ask the patient to wear a wearable for many reasons. So we came up with that idea. That idea is AwareAI, that give awareness to the caregivers using a Vision AI to monitor their patients for better triage. What did that do? Well, first, it gives real-time continuous data to a caregiver for better triage of those patients. Uh, Sometimes, when the nurses or caregivers are doing their rounds in a floor, you might be finding important that it might be better to go to the patients that are in better need first, and then the patients that are asleep last. So how we can give that data to those caregivers without disturbing the patient, but without, intruding into their privacy either, and giving relevant information to those caregivers. Or alternatively, how we can give a history of data of the patient for since the last time they were seen by a caregiver. How do we know that the caregiver had a I don't know, a respiratory event or a cardiac event, etc. That was not visible or available for the caregiver until they were to visit the patient. So that's basically the idea, is how we can create technology to do all of these in a space that is already crowded, in a space that is already invaded by other types of technologies. So we came up with our AI. So our AI uses the existing platforms, the existing technology at the patient room already, meaning we don't need to bring another device to the patient room for us to accomplish what we just said. We provide that data within the existing hospital platform with all the protocols necessary for the patient data to be transported through the hospital and be presented to a caregiver in real time. And we do this in a way that we protect the patient mobility and privacy.
It's a really, really interesting platform. I mean, when I first saw Aware, and when I first became aware of Aware AI, I thought to myself, okay, it's another remote patient monitoring platform. It's a vital signs monitor, early warning system. And I started to dig a little deeper and get a better understanding of the platform. And all of a sudden it was okay, it's a remote patient monitoring platform which has got highly specific vital signs monitoring in, and it starts to add features and starts to add interest. And then I thought, okay, there's a telemedicine angle here as well, where you've got the patient history, which you can then use AI to build new baselines for that patient. And again, it adds an additional layer of interest. And then you talk about being able to retrofit essentially any high display camera system on the planet. And all of a sudden, you've got a really, really quality collection of tools that solves a real world problem. You've got a shortage of caregivers in the US, in across Europe as well. I've read something that a nurse can safely care for 8 patients. And I know that in the NHS right now, I think a nurse is caring for 22 patients. So conditions are worsening on wards. People are getting more sick when they're in hospital. Aware, really, really interesting way to try and facilitate that nursing team with the tools and information they need to triage in the best possible way.
Exactly, yeah, and that's exactly it. Is what is the real problem that we're trying to solve here? Yeah, it's not that a patient might need patient monitoring per se and being watched 24/7. It's not that. It's the caregiver's ability for them to understand the real-time situation of a patient that might be recovering, might not need that 24/7 monitoring, but is still at a hospital under their care, and how we can help those caregivers properly triage the group of patients that they need to care of, and provide real actionable data for them to make those decisions. That's basically it. Now, we can extrapolate from that and then look into other workflows. So, simultaneously, we can think of, okay, so what are other workflows that require at the same time, the same type of data for those other caregivers that to provide better care to this patient. So imagine um, um, uh, a multitude of patients, let's say, sitting on a emergency room, and how we can give the nurses at the emergency room another layer of ability for them to triage better the patients, so we can monitor the patients, all the patients that are in the emergency room, and give some signals to the caregiver about a particular subject or another, or a few of them that might have a better interest. Let's put it that way. And then you can further extrapolate, is there any other industries that might require this? Are there any other spaces in the market that can benefit from this? And yes, the answer is absolutely yes. But we need to focus. We need to focus on what is the best way to utilize this technology now, and how we can provide those caregivers a solution that they really need.
I think the ER application is incredibly interesting as well. You look at ER times in general that are on the rise. Again, NHS ER waiting times in some areas of the country are up to 20 hours that you'll spend in triage. And yes, there are current triage methods in place, but how good are they? They are observational. AI has unlocked a world where observational triage should be improved, should be much better by looking at data sets, existing data sets for patients, and looking at vital signs. I think the ER application is equally as interesting as the wards application. It's about speeding up those use cases of patient danger, of patients that are in a very, very bad place, whether they're in the ER, whether they're in the wards. Um, Again, you think about the purpose of turning mode, and it's challenge. We will find a solution in order to meet that challenge.
The technology exists. I mean, in very rare cases, we actually had to create the technology from the ground up, and so technology exists. Is really understand the problem that you try to solve, and how you best fit technology to really address the problem of the subject that is suffering from that problem. I mean, of course, the patient needs to get better care, the patient needs to get better outcome, but most likely than not is the caregiver, how we can solve a problem to a caregiver for the caregiver to provide the care that they want to provide to their patient. Yeah.
Absolutely. Well, tell us a little bit then about the technology, Jorge. What are you building this on? How are you assembling this?
Um, so it started with a monstrous piece of technology with a multitude of computing platforms, a multitude of sensors, but it is today a SaaS system. The journey to get from that to where we are right now was very painful in many ways. I can spend a few hours telling you what not to do, telling the audience what not to do next. But the gist of it is that we first needed to understand if we were capable to produce the data at the time and at the rate that the caregiver needed. And the answer was yes, yes, we can do that. Now, in the background was a monstrous piece of technology. So we realized that was not going to be conducive to something that a hospital will want to invest or put in every patient room. So we understood that there was another customer to the process, and that customer is the actual hospital, who's not who's going to use the device, but who's going to pay for the device. So we needed to solve that problem. We realized that we needed to solve an additional problem. And while we were doing that, then we realized that we also have another problem to solve, and that's how we needed to integrate with existing technologies because nobody wants it. I mean, sometimes redundancy is important, but more often than not, redundancy is not something that you need to focus on. So how we can eliminate redundancy into how our device were going to work. So that's how we end up. Uh, uh, that's how we arrive to a place that we needed to develop a SaaS solution. So technology can be used with existing hardware in the room. So we didn't need to go and upgrade or retrofit hardware or install new hardware, but instead using existing hardware and produce the data. The actual solution was how we can construct the data and transport the data so the caregiver can actually use it. In a nutshell, that's what it is. Now, we can take all of this into pieces, and I can tell you all the mistakes that we're still making, but the mistake that we made trying to find this that solution.
You talk about, the mistakes, and I don't think any entrepreneur alive has ever had a easy route to market and an easy development journey. Maybe they exist. I've personally done it 4 times and failed twice, and not one of those 4 times have been easy. What has been your biggest challenge? You mentioned technology challenges. You mentioned innovation challenges. Where do your challenges come from, Jorge?
Where to start, Greg? Uh, I guess the biggest challenge is me. Is ignorance. I think I know what to do, and very seldom realize that I don't know what I'm doing. That's the first challenge. Is that and doesn't really matter how many times I go through this, I end up in the same place. Well, I guess I need more help. That's basically it. And not realizing from the beginning the type of help that I need. That's basically the answer to you. Now, what that means? Um, I'm very good at finding problems. I'm very good at understanding technology and how to solve the problems. Beyond that, I need lots of help. How to actually create a technology so it can actually solve the problem. So partnering with the right technology partners for us to be able to be efficient and effective on how to do that. Um, how to do the market assessment. And partnering with the right organizations to really understand the market needs and how the solution fits that problem. It's been a challenge. I recognized from the very beginning that I needed that help, but understanding how to engage, how to interact with the organization is very important. So you don't end up with a bias answer to your problem. happened to
You're
us
you're the
a number of
unicorn,
times.
Jorge. Usually there's a bunch of commercial co-founders who are looking for technical co-founders. You're the technical co-founder who's always on the hunt for a commercial partner. So I'm sure
Yeah,
you'll be the most popular person alive.
no, but that's it. That's exactly it. And you mentioned it at the beginning. You end up with a commercial opportunity. You start with a commercial opportunity that trying to find the problem to solve, and that's a path. And some people have been very successful at that, but I don't subscribe to that. What is the problem that I really try to solve, and how can I better fit technology to solve that problem? And if you find the right technology to solve the right painful problem, you know the money will come. Now, that's another challenge that I have. Thinking that it was overly simplistic to find funding to address this it has been a big challenge. A couple of times I ended up finding the solution myself, which in itself is a problem. You will become more and more biased as you invest more and more, and then the opportunity um, to stop becomes distant and blur because how much you're investing into it. And through that, I actually came up with a concept of looking for no instead of looking for yes. Um, and recently, I gave a talk in Mexico about that, and that is, as an entrepreneur, I will always be looking for yes, for confirmation that what I'm trying to do is actually valuable and brings value to the market. But in reality, what I should be looking is for no. Uh, Somebody who is that person that is going to tell me that what I'm doing is not going to bring value to the market, and how can I refute that? And if I can refute that, then I'm still in the game. But if I cannot refute that, then it's probably time for me to stop and look at my next idea. In a nutshell, that gives me peace at night, and I go to sleep because okay, I didn't found no today, so I guess I will wake up tomorrow. I keep at it. But a couple of times I have to make that very difficult call to, okay, it was fun, it was enjoyable, it was a very expensive learning opportunity, but it needs to stop.
It's a healthy attitude to money. I mean, on this podcast, we talk about funding, we talk about investment, and when we talk about bridging the gap, because like we say, behind every innovation is a VC or angel or private equity company that is funding that innovation and funding that journey. And I think dilutive funding often gets a bad rap. It often gets there are partners out there and there are firms out there who see their involvement in your success as money. And in reality, a good funding partner is there to, yes, provide money, but also provide support and provide a sounding board and ultimately say no, like when they need to say no. I have attended many workshops, attended many talks by some of the top VCs on the planet and some of the top entrepreneurs on the planet talking about what was it like the first time you got funding for your startup? Because you spend 2 years building something, you spend 2 years growing something, and that is your creation. When all of a sudden you bring in a partner and that partner starts saying no, and they start asking difficult questions, and they start challenging you, and you're sitting there thinking, who the hell are you? Who are you to tell me how to run my business? And actually you got to flip that on its head and say, no, that is the healthiest thing you can do as an entrepreneur is listen and be challenged. And you don't always have to accept the challenge. You don't always have to lay down and say, yes, this is what we're going to do to move forward. But actually taking on board feedback and entering into an equal partnership is the key thing.
Yeah. There is um, so many places for you to fail to recognize where to stop, either from problem solution recognition, from technology to solution match, to partnership that you are equipping, or the strategy to go to market or the strategy to exit. Plenty of opportunities for you to fail to see um, the the signals to stop. Um, the way I guess I have tried to mitigate that after making the mistakes is try to surround myself with the right DNA, different to mine, that for me to have additional, as many as additional perspectives, points of view to the problem as I could possibly get, so we can get to that no faster, right? So from that problem perspective, usually my angel investors are physicians that are in the area that I'm trying to solve. So uh, usually I get a lot of confirmation bias by them because they see the problem in itself that we want to solve, and they come with a very important perspective of the problem, and they want to solve the problem. So although it's very beneficial to have them as your early investors for credibility, etc., it's also a danger situation because of the confirmation bias that they can bring as well. Then you go into the market component, and then I'll try to get uh, experience from a commercial point of view on how to make the idea profitable. How can I actually make money with this? Because, by the way, we are here to make money. Yes, we're solving problems in healthcare, we're getting better clinical outcomes, but at the end of the day, we're making money. So how can you actually monetize that idea into something that can be sellable? And the challenges are immense. Are you going to build a new industry? Are you trying to get to compete with a very large multi-billion-dollar organization? How are you going to try to get into the market, right? And what is the best way for your technology to be in the market and solve the problem? And that in itself lies a big problem. Do you, as an individual, want to be that, or you want your technology to be that? And comes ego comes into place, et cetera, et cetera. And then you move to the last stage. Is okay, now that you have a path to market, what is your exit strategy? And who are you surrounding yourself so you can have the best possible exit strategy, so you don't end up tied up married to a technology for the next 20 years, which I don't want, right? I want to move to the next idea and solve the next problem, but in the process, I have fallen in many traps that will marry you to that technology and anchor you down for longer period of time that you initially thought. I'm going to stop there and give you some reaction. That was probably a lot.
I'm a firm believer in the ethos. I don't think I created the ethos, but I certainly spout it enough that there's no such thing as a medtech SME. There's medtech startup. The world is full of medtech startup, and there's medtech enterprise, of which there are a few, and then there's medtech leaning private equity that are building portfolios of quality medtech. The medtech SME does not exist. So everyone needs a 5 to 10 year exit strategy, ideally 5 year. That's what we were always looking for when I was managing a medtech VC. And it's an interesting perspective. You don't want to be bogged down. You don't need the exit. You need the exit because everyone needs an exit to justify the success. But you're not looking for an exit to buy a boat and sail the Mediterranean and chill. You're looking for an exit so you can move on to the next idea, the next technology, the next thing which can improve the lives of patients. So it's a very, very noble cause, Jorge. I should congratulate you on your approach to being a medtech entrepreneur.
It's also come to my demise. You have these 12 ideas that I mentioned at the beginning, and I quickly realized I don't have the lifetime to try them all.
Oh,
So how you prioritize them?
it's good. Yeah. How do you prioritize them? Um, let's finish up the conversation about Aware. What's next for Aware, Jorge? Where are you taking it next? What's the sort of go to market look like for Aware right now?
Yeah, so in that journey that I was mentioning earlier, that we realized the Aware feeds into other organizations' technologies. So that's the strategy to go to market, is how we can package the technology so it can be consumed but industries, by other devices that are already in the market, for them to be more effective, more efficient, and give those caregivers the data that they need for the caregivers to make better solutions. So that's the strategy to go to market. It's not to go there and compete, it's go there and improve technology that is already in the market. That's that. It's gonna take time for us to get there. It is taking us time to find the right partners to introduce this. There are organizations that are interested into working with us and doing pilot testing on how to integrate the technology and prove the value. Um, so we will be in the market in the next a few years with a package that actually solves these caregivers' problems with the right technology through other platforms. So caregivers can actually enjoy the solution and don't have to look into yet another screen. They don't have to look yet into another platform for them to get yet more patient data, but have it in a place that they are already looking. I see this technology fitting in the markets in the next 5 to 10 years in a way that more patients are going to need more care, and caregivers are not growing at the rate that patients are growing. So as tech leaders, we need to provide real solutions to those caregivers for them to be more efficient, for them to be able to provide the care that they want to provide to their patients. That's how I see our fitting into that 5 to 10 year future. We will probably add features in the next 5 to 10 years to the technology. There are plenty of opportunities with the approach that we're taking on how to improve, learn, and repeat to give more on the same platform. Um, but that will come into a later podcast, Craig. I will update you on that in
Absolutely.
5 years.
Love to have you back, Jorge. So you're looking for partners, looking for integration options, and like we said previously, looking for that commercial support and somebody to bounce ideas off of. Good shopping list
That's right.
of actionable items there for you, Jorge, for you and a aware and turning mode. Um, so don't want to take too much more of your time away. Thank you so much. But I'm always fascinated to know what your an experienced medtech professional, couple of successful startups under your belt. What are you really excited about right now in the medtech space? What technologies are you keeping an eye on as far as applications? And like you said at the start of this conversation, you are in the solution space and the challenging circumstance space. So what's got you excited?
Um, I have always been fascinated by vision, computer vision, and everything that you can do with technology that can actually gains inferences from visual capability. It's very intriguing to me the technologies that are getting into the market on how to improve capabilities in that end, not only in the visual spectrum, but in the near visual spectrum. How we can give, in this case, specifically caregivers, additional insights in the near visual spectrum, something that they cannot naturally do. How we can actually give that ability to those caregivers for them to realize things that are probably unimaginable today. That's very exciting to me. There are a number of startups out there that are developing not just the sensors, but the computing capability on board for you as a consumer of technology to use that and produce better data for those caregivers. Uh, that's very exciting. The computing capability of today was not in my wildest dream 20 or 30 years ago. So computing capacity in 10 years, I cannot fathom what is going to be. So that's very exciting. I can't wait to get access to better, faster, smaller computers with less power requirements. I know it's coming. I know we are in a place that technology is going that way. Power consumption is an issue. Heat dissipation is an issue. How the companies are solving that problem is very exciting to me.
Absolutely. I think we're at the next evolution of AI. People have just started understanding language processing through AI. And I'm talking about the general public here, not the technology consulting crowd, which I find myself in. You look at vision AI as the next evolution of that. So you can converse freely with AI now. People are used to having an Alexa device or Siri. Next, you've got to think about vision. You've got to think about video, and you've got to think about an AI platform in your home, not necessarily Aware, because Aware is clinic, but there could be a future of it being in the home where, and this is equal parts scary, equal parts amazing, that it's going to be able to detect early signs of stress. You know, your Alexa device could be watching you again in the right way, and it could be saying, Craig, you need to get yourself to the hospital. You need to go to A&E. You are on the cusp of, of a clinical episode. I am very also excited about the future of vision, about the future of particularly image processing and video processing and using imagery in order to, advance human life, I guess. So yeah, it's an interesting point, one that I'm also very excited about. We'll wrap up, Jorge, but final question from me. What is your one piece of advice? You've given some great advice today. This is a platform for entrepreneurs to tell all, warts and all, good and the bad. What's your one piece of advice to anyone out there that's at the early stages of their medtech journey?
Yeah. So I'll give you one that I wish I had 10 years ago is look truly into the problem that you're solving. Truly. Could be that problem is addressing something for the patient. But what is the real problem that you're solving? And who is paying to solve that problem? Who is your real customer? What is your customer personas? And draft truly the journey of those customer personas, different ones, and understand how your piece of technology solve their problems collectively. Your technology might solve a clinical situation, but it might not fit in a hospital setting. It might not fit on a reimbursement setting. It might not fit on a commercial setting because another technology might be competing with it and somebody might want to bury it for commercial purposes. So look truly into how your problem fits into all of these aspects and do the journeys of your customer personas, as many as you can find out, and understand how your technology is solving those problems collectively.
Great advice, Jorge. We don't. It's important to look back sometimes and say, I'm doing this for the patients. I'm doing this for the right reasons, but ultimately, it's got to be commercially successful. It's got to make sense. And like you very, very astutely put, who will buy this? Who are going to be the people? Is this going to be reimbursement based? Is this going to be end user based? So fantastic tip. Jorge, thank you so much for your time today. Much appreciated. Thanks everyone for listening in to the MedTech Ventures podcast, and we'll join you in 2 weeks for the next edition. Thanks, Jorge.
Thanks, Ray. Bye.